Hi, it's Liam here from Muscle Doctor, and today we're taking a look at banded ankle mobilizations. So why would we want to mobilize the ankle anyway? This is an ankle and this is dorsiflexion, and sometimes that movement can become restricted, which can limit gait and cause other ankle problems and dysfunction. That can be coming from the rear with tightness in the muscles, the gastrocnemius and soleus, but it equally can be coming from restriction within the joint itself, causing impingement anteriorly. So between the tibia and the calcaneus or heel bone, we have a bone called the talus. And as we dorsiflex, that talus needs to glide posteriorly. If this isn't happening, we can use resistance bands to help us mobilize that and to get it gliding. So for this, we need to use some resistance bands. I've got the Physique mini bands. I'm going to be using a yellow, which is the lightest. If we need more resistance and a greater mobilization, we can increase the band strength. So let's see how it's done. So as you can see here, I've got the resistance band mounted, anchored to the bottom of the treatment couch, which is handy in a clinical environment. If you're not in a clinic, there are other alternatives. So you can use a door handle with the band looped underneath the door, so it's on the opposite side handle. You can also use a secure table or chair leg. Sofa leg works well. Anything that you can find that's secure and safe. What we're going to do is bring this band up. This is the lightest resistance band to start, and I'm going to loop that around the ankle. Just there. So we want to make sure that it comes underneath the medial and lateral malleolus, so the two bony projections of the ankle there on either side. We need to make sure that we bring the foot far enough forward that the force of the band is pulling backwards. So as long as that's beneath these malleoli, it's going to be pulling the talus backwards, which is what we need as we start to dorsiflex. So from there, we're going to start to push into dorsiflexion and then come back. So we're doing this as a pumping movement through repetitions. As soon as we feel the heel lift up off the floor, we've gone too far. And we're going to continue doing that, generally for about 3 sets of 10 repetitions. And what we're hoping for is more mobility and greater range of motion the longer we do it.